A man collapses at mile 8 of a marathon he's run every year for a decade. Paramedics find no warning signs in his history. Clean blood work, low resting heart rate, a body that looked, by every normal measure, healthy. What killed him had been growing inside his chest for years, and his own body had been actively hiding it from him. For roughly half of all men, the first sign of heart disease is death itself. No chest pain, no warning, nothing. Today we're breaking down exactly why a healthy heart can fail without warning, how your body conceals a blockage that should be killing you slowly, and the only screening method that can actually catch it in time. To understand this, look past the chest wall at the heart's fuel lines, the coronary arteries. Think of them as root systems feeding a tree. Sever a root, and the branch it feeds dies almost instantly. The left coronary artery splits into the left anterior descending artery, or LAD. Doctors call it the widowmaker because it feeds the front and base of the heart's main pumping chamber. Block a small branch, you lose a bit of tissue. Block the LAD, the whole pump can fail at once. So how does someone who exercises daily develop a blockage? It starts at the vessel wall. A healthy artery is like a new, flexible garden hose lined with a smooth layer called the tunica intima. Over decades, high blood pressure, high blood sugar, and smoking wear at that lining like sandpaper. Even the mechanical stress of years of intense endurance training can cause microscopic tearing. The body patches that damage with LDL cholesterol. Immune cells absorb it and harden, forming plaque, a mix of cholesterol, calcium, and cellular debris. This buildup is atherosclerosis. Here's the misconception that gets people killed. Most people picture plaque like a clogged drain, narrowing gradually until flow stops, and assume they'll feel it coming. That's usually wrong. Arteries stretch outward to accommodate growing plaque, a process called positive remodeling. The channel can stay fully open, even as plaque builds up underneath. You can run 10 kilometers and feel completely fine, right up until you don't. So what flips the switch? Stability, not size. Picture the plaque as a blister with a thin skin over an inflamed, unstable core. A sudden spike in blood pressure or extreme exertion can tear that covering, a plaque rupture. The body reacts like it's healing an open wound, rushing platelets to clot the site. That's the right response to a cut finger and exactly the wrong one inside a coronary artery. Within minutes, the clot can seal the vessel completely like a cork in a bottle. That sudden blockage, or not the plaque itself, is what triggers a type 1 heart attack. There's a second pathway that often catches endurance athletes off guard, the type 2 heart attack. Picture a disciplined 50-year-old runner, normal cholesterol, no chest pain, just fatigue, lightheadedness, and nausea he assumes is dehydration. His blood work shows elevated troponin, a protein normally sealed inside heart muscle cells like the liquid inside a glow stick. It only leaks out once the cells rupture. But his arteries are only 50% narrowed. This is a supply and demand failure. At rest, a 50% narrowing barely matters. But when his heart rate spikes to 170 during a race, demand jumps to levels the artery can't supply, and the muscle starts to suffocate, ischemia. Add atrial fibrillation, where the heart's upper chambers quiver instead of contracting properly, and you get a perfect storm. This points to the 70% rule. Chest pain typically doesn't appear until a blockage exceeds roughly 70%, since the body compensates below that. Above it, you might feel tightness climbing stairs that eases with rest. Stable angina, your body's check engine light. But most heart attacks happen in arteries, blocked less than 50% because unstable plaques rupture more easily than large, stable ones. If you can't feel it coming, is there any protection? Your heart has a backup system called collateral circulation. Think of your main arteries as interstates. If a blockage develops slowly, the heart can build side street detours around it. That's part of why a 70-year-old sometimes survives a heart attack that would kill a 40-year-old. The older heart had decades to build alternate routes. Zone 2 cardio and high-intensity training encourage this backup network to grow. Time matters most. In emergency medicine, time is muscle. Within 20 minutes of a full blockage, damage begins. By 90 minutes, heart tissue turns to scar tissue that can't pump. Men tend to get textbook symptoms: chest pressure, arm pain. Women's symptoms are often subtler: fatigue, shortness of breath, even acid reflux. A sudden, inexplicable sense of dread is also a real warning sign. When the plumbing fails, cardiologists perform a PCI, threading a catheter through the wrist, locating the blockage with dye, inflating a balloon to compress the plaque, then placing a stent to hold the artery open permanently. But the real goal is catching this before any of that's needed. Standard blood work only shows what's in your blood, not what's sticking to your artery walls. A KC score is a 5-minute scan measuring hardened calcium. 0 is ideal, above 400 signals serious risk. A CT angiogram goes further, revealing soft, unstable plaque before it hardens. The invisible blisters most likely to rupture. Most heart attacks in seemingly healthy people aren't random. They're years of invisible damage nobody checked for. Control blood pressure to limit the mechanical tearing that starts this process. Manage blood sugar to reduce the inflammation that drives it. Stay active to build the detours that could save your life. Don't assume you're healthy because you feel healthy. The technology to know for sure already exists. Use it.